on an all-new episode of Let's Talk Cincy, a local program serving both children and adults. The story of Central Clinic Behavioral Health.
We have to remember that trauma was always there. One thing that's different today that wasn't before is that we're talking about it. So some things that are happening today, we just might be more aware of them because people are talking about it.
Helping transform lives for more than 100 years. From WLWT, this is the Emmy Award-winning show Let's Talk Cincy, presented by Western and Southern Financial Group. Put our financial strength behind you. Here now is Let's Talk Cincy anchor Curtis Fuller.
Hello, everyone, and welcome to Let's Talk Cincy. You know, thousands of people, including some of your neighbors and family members, face challenges every single day because of behavioral health issues. Today, I want to talk about a program here in Cincinnati, the first mental health nonprofit organization right here in the state of Ohio, established in 1923. Over the past 100 plus years, the folks at Central Clinic Behavioral Health will tell you the organization has maintained a strong tradition of responding to the community's needs by providing mental health and substance abuse services and so much more.
What we're doing is building on that tradition. So it is learning ways to hear what the community needs and then find creative and innovative ways to make things happen. So over the years, we have developed program after program in response to needs in the community. And it's not just to create, oh, we need a behavioral health organization, let's do therapy services. It's about trying to find those really niche services that we are needing so that unique populations can have very specialized services that meet their true unique needs. And then learning also how to pivot. So as the community needs changes, we also adapt our program. So we pay attention, we keep our ears to the road. We listen to our clients, we listen to our therapists, we listen to the community, and we just try to make it happen. When I came into the seat, the one thing that I noticed is we have a lot of programs. We're in 10 locations, in 3 different counties, 6 divisions, and each of them have their own unique needs. So we're not seeing that this is Central Clinic. What we are seeing is this is adult services, or this is a child and family treatment center, or this is court clinic, or family healing center, or boys to men. There's so many different programs, but what it is we need to kind of incorporate is all these programs are Central Clinic. So part of my job today and going forward is helping the community realizing what this little secret is. We're Central Clinic. We're Central Clinic Adult Services. We're Central Clinic Boys to Men. It's getting the community to know what they know already. They just didn't know it by its name.
The issue of mental health and just social needs is greater now than it's ever been, to at least I think in my lifetime. Which is a huge weight to carry for an organization and to meet or to feel as though you're meeting all the needs. Just talk about how you have, the organization has navigated that and what some of your plans are going forward.
Well, how we navigate it is by paying attention. We listen to our clients, we watch the news, we listen to the therapists. We also, as an agency, pay attention to trends. We look at our outcomes, what's working, what's not working. We're constantly asking our clients and our staff to do some staff satisfaction and client satisfaction surveys. And it's not just to do a survey, but it's really to gather that information so we can find out what's working and then do more of what's working. And if something's not working, it's like taking a group together and saying, well, what isn't working? What are the other kind of possibilities? What could we do? So it's not just stopping something, but looking how we can adapt, okay? It's also like paying attention in the community and hearing, like, there's a new program called Senior Connections. Well, I was in a meeting and I had heard, hey, they're needing more services for seniors. And I'm like, our adult services program, we really help seniors. Why don't we get together with them and find out what they're looking for? So that's now in the infancy phases, where we are developing a program to meet the needs for adults and seniors. So what does that start with? Let's go to our seniors and ask them, what is it? What do you need? How can we make your life better? Just this last October, we did an event called Vibes and Lives. This looks to be an annual event, and that is to help us build some fundraising to help us do these unique things. Things that might not be able to be billed through Medicaid or Medicare or other funding sources, but can help us continue our mission. So it does take people in the community to help us help you.
Welcome back, everyone. You will hear the folks at Central Clinic say that success comes when you really listen to the needs of the people you are serving. The organization serves a diverse patient and client population. The goal is to help folks become stronger, healthier, and full participants in their respective communities.
There are lots of individuals that live in our community that do not have family or peer support systems. There's lots of individuals that even if they do have those support systems, they may not feel comfortable accessing them for the type of support that we can provide here. It's really interesting. There are individuals that will come visit our office even on days when they don't have appointments. They'll come up here, they'll spend time in our lobby, they'll chat with one another, and it's really just become a place where people can feel comfortable and feel like they can be themselves and also receive the support that they need at the same time. We work with individuals age 17 and a half on up. In adult services, we are a comprehensive behavioral health agency. We provide medication services, therapy services, case management services, as well as psychological testing. And we do run a couple niche programs within adult services as well. We actually just received our census report, and we were between 12 and 1,300 clients for our previous fiscal year that we served in adult services. There are some folks we work with that might come and work with us for a few months and feel that they've received the recovery and support that they need. Just yesterday, I met with a client of ours who let me know that she's been coming to see us for 35 years.
And that would be that's more of a unique situation.
It is unique, but it is not unusual for clients to work with us for many years. We work with a lot of individuals who have lived through a lot of trauma throughout their lives. And the longer you experience this trauma, it goes hand in hand with the duration of treatment that one might need to achieve their recovery. But when it comes to, individual clients, and for me to know that I've met the mark, that we've done our role here, it's going to be different for every individual. There's some clients that might have achieved a prolonged period of abstinence from substances. There are some clients on the other end of the spectrum that just simply showing up every week for treatment lets me know that we've done our job and that we've achieved a goal. It may not be the goal of full recovery, but that lets me know that we've done what we need to do to get things started with that individual. I think our success lies in our ability to adapt. As Dr. Mages mentioned earlier, we look at the unique needs of the community, and if our services are matching the needs of the community, then I think we've been successful as an agency. We're really excited at Adult Services to be in the early stages of a new program called Senior Connections. This program is we're partnering with the Council on Aging and the Hamilton County Mental Health and Recovery Services Board. And we're going to be working towards broadening our services to seniors. we have a very large percentage of our clients here are over the age of 60. Recently, we looked into our numbers and we realized that almost 25% of the clientele that we service in adult services are over the age of 60. And you know, when I think a lot of people, when we think of individuals living out their golden years, what comes to mind is folks living in a safe retirement community, playing tennis, playing golf, knitting, and unfortunately, that's not the reality that a lot of seniors experience in our community here in Greater Cincinnati. And we are really looking forward to help minimize that gap between what many people face and what actually exists. There's a lot of individuals that don't have peer or family support. They might be living on their own, may have very little contact with anyone outside of their home. There's a lot of individuals that really struggle to coordinate their medical care. There's folks that might even be homeless. And we're really excited to be launching a program to address all of these unique needs in the community. Unfortunately, both the needs of individuals increase as well as their vulnerabilities at the same time. And it can put people in a very bad position if they don't have the appropriate lifeline in place to address those concerns.
Another life-changing program at Central Clinic is called Boys to Men. It is a much-needed mentoring program, especially in today's world, to connect boys to adulthood.
It was sterile to just talk to somebody for an hour and really understand their story. And so, especially with the young men, it came down to me understanding how they interact with others and how they tend to get along, because it's indicative of how they may act in school. So what I decided was to have a group, and it started out with a group of maybe 5 boys. And I talked to my then director, Dr. Charles Collins, and the CEO. Hey, I want to do a group. And they said, fine, if that's what you want to do, go ahead, go ahead about it. And so I kind of designed that we would do it on a Saturday. And the reason why we decided the Saturday after talking to my directors is because most kids get in trouble on Friday night and Saturday night. And so our group starts at 3 o'clock on Saturday, and we don't end to sometimes like 9:30 at night, which means that they're going home instead of going out and getting into trouble. So it kind of worked out. Once it caught on, the directors decided they was going to hire somebody else to kind of help me out. He is now moved on, but I had Mr. Orville McDonald used to be my co-facilitator, and we would have 15 boys. And Michael is a big part of that because he came around that time, and it was just a huge success. Boys loved it. They couldn't wait to come every Saturday, and it just turned into a fraternity of boys who really, really want to see each other and work together for that day.
And I would assume want to improve their own situation.
Yes. So it is therapeutically based because the topics, as we will call it, the group topics or therapeutic concepts are based on, things that they need to work on in terms of school, home, and community. We have our belief system of, we're going to develop the young man spiritually, mentally, and physically. Physically, we go out and we do exercises, we play sports. They love that. The mental piece is understanding, the group topics and how they relate to your life. And of course, the spirituality part is like doing the right thing, not getting into a situation where you're doing things that you shouldn't be doing. And so this is drilled, week after week. And so it gets to a point that people really understand what's going on. People like Michael, you can tell they have an aha moment, like this is what this is really about, and they really understand it, and then they really like it. And like I said, some guys will call me and say, hey, are we having group today? I was like, no, I think I'm going to be off this week, but we're going to have it next week. And so it's always wanting to come back.
Adding a program through my other therapist, she recommended me to the program. What it has done for me as a man, and taught me to think more and not react first. So a lot of things I just think about first before I, react. It put me in positions to be more successful in my life. Keep me occupied, because like he said, trouble happens Friday night, Saturday nights. Me growing up, I used to get in a lot of trouble. Now being in this group, it takes away from that, which is a good thing. As I'm growing up and maturing, it helps me out a lot, a lot.
A lot of these young men don't have fathers, and so they don't know what it's like to understand what it is to do the right thing as a young man. And so, and hence boys to men, right? We want them to mature and become men. And I always tell them, I don't care if you're rich. I don't care if you're famous. I care about you doing the right thing. And I always say, I don't want to be perfect. I just want to be doing the right thing at the right time. And that's what I teach.
When did it click for you that this was a good thing for you?
Right around, I want to say my sophomore years, my grades started getting better. Behavior started to change. I was less, as a troublemaker to my community. Just being an all-around good kid. And then it started to click, everything started to click. And that's really when it started to click more. And I was like, this group is really for me. So now that I'm, a mentor now to the other ones in the program, I tell them that it's okay to do right. It's okay to be, in the house more. It's okay to do that. You don't always have to follow others. That's not the way to go. So I try to tell them that as a leader, and some of them get it. That's how it goes.
There is currently 10 or 11 kids in it right now, but we have served hundreds of kids. I mean, some kids come in and they stay for a long time. Some kids come in for 6 months and they feel like they got what they need and they move on. So we've served a lot of children over the 25 years that we've done this. But Michael is an exception. He and another young man has decided, well, they want to come back in and they want to mentor these younger kids, and they wanted to give them their experiences. And that really helps. What's really dynamic about this program is that we get visitors all the time from people who were in the group 10, 8, 9 years ago. And they come back and they offer their feedback. We have people who are willing to come back and help us. We had one guy come back, he had gotten a job at Chick-fil-A, and he got a permission from his supervisor to give all the kids meals. I mean, I almost cried that day because he understood, once you're given, you return that, and that's what this is all about. You give and you give and you give, and eventually it comes full circle. These kids come back and they give back to it. So that's why I'm proud of it. And it's not my group, it's their group. We were talking earlier today, it's these people who are in the group now who are probably gonna catapult it further And I'm proud of Michael because Michael is wanting to be here and be a part of that.
Well, I think no matter what generation you come from, trauma always exists and it changes. Each generation has its own challenges. This new one, we had COVID. That totally changed how we look at the world and how we experience the world. Technology has changed how we experience this world. You know, iPhones didn't exist when I was growing up, right? You had to use actually 2 dimes to put into a phone to call somebody. You can't even find a phone booth. So how we are growing up changes. But we have to remember that trauma was always there. One thing that's different today that wasn't before is that we're talking about it. So some things that are happening today, we just might be more aware of them because people are talking about them. So maybe it's not that the world has gotten worse, but that we're actually starting to talk about it more. So what we need to do as an agency is actually get people more comfortable about talking about the things that are hard, right? Talk about the traumas. It's okay. We've all experienced traumas, but what are we doing about it? And what you can do about it is reach out to somebody, talk about it, and ask for help. My signature is to get all of our programs working more collaboratively. So you have the lifespan from all the way at the very beginning to all the way at the end, working closely together. And also really to enhance the transitional youth. When I start looking at the community and what we need, we serve youth, we serve adults. But there's this special area of youths transitioning between the child system and the adult system. And that's an area for us to grow in. We are a gem. You know, Central Clinic is that unique niche in the community. It's not only a great place for you to get services, but it's also a really great place to work. You know, my father had told me early in life, it's not how well you do in life, but it's about doing good, right? Central Clinic is an opportunity where for people who want to do good, can do good.
Well, I hope the information shared helps someone who might be struggling or just feeling overwhelmed. The story of Central Clinic is a reminder that you are not alone. Well, that does it for the program today. I'll see you next time for another edition of Let's Talk Cincy. I'm Curtis Fuller. Have a good day and a better day tomorrow.